We are describing a situation where a person's blood pressure suddenly dropped, which then triggered a heart attack happens in the middle age. A sudden drop in blood pressure, known as hypotension, can indeed lead to insufficient blood flow to the heart muscle, which might result in a heart attack if the blood supply is severely compromised for a prolonged period. If you have any specific questions or if you'd like more information about blood pressure, heart attacks, or related medical topics, feel free to ask. Heart attacks can occur in middle age due to a combination of factors related to lifestyle, genetics, and underlying health conditions. Middle age, which typically refers to the years between 40 and 65, can be a critical period for heart health. Here are some reasons why heart attacks can occur during middle age. Risk factors accumulation. Many of the risk factors for heart disease, such as high blood pressure, high cholesterol, obesity, and diabetes, can develop or worsen over time. Middle age is a period when these risk factors can accumulate due to factors like poor dietary choices, lack of physical activity, and increasing stress. Unhealthy lifestyle. Middle age can be a time of increased responsibilities, work stress, and family obligations. This can lead to unhealthy lifestyle habits such as poor diet, lack of exercise, smoking, and excessive alcohol consumption. These habits contribute to the development of cardiovascular risk factors. Metabolic changes. Metabolism tends to slow down with age, which can make it easier to gain weight. Weight gain, especially if it leads to obesity, is a significant risk factor for heart disease. Hormonal changes. For women, the transition through menopause can bring hormonal changes that affect heart health. Decreased levels of estrogen, which has a protective effect on blood vessels, can increase the risk of heart disease after menopause. Genetics. Family history plays a crucial role in heart disease risk. If there's a history of heart disease, high blood pressure, or other cardiovascular conditions in your family, your risk of experiencing a heart attack might be higher. Pre-existing conditions. Middle age is when certain health conditions, like diabetes and hypertension, can become more common. These conditions significantly increase the risk of heart disease and heart attacks. Stress and mental health. Middle age can come with increased stress due to work, family, financial obligations, and other life changes. Chronic stress and mental health issues like depression and anxiety can contribute to heart disease risk. Lack of regular checkups. As people get older, they might become less vigilant about regular health checkups. This can lead to undiagnosed or poorly managed risk factors for heart disease. It's important to recognize that heart disease is often preventable. Adopting a heart-healthy lifestyle that includes a balanced diet, regular exercise, stress management, avoiding smoking, and limiting alcohol can significantly reduce the risk of heart attacks and other cardiovascular problems. If you have concerns about your heart health or risk factors, it's recommended to consult with a healthcare professional for personalized guidance and preventive measures. I can provide you more information about blood pressure, heart attacks, and their relationship. Blood pressure. Blood pressure is the force exerted by the blood against the walls of the arteries as the heart pumps it around the body. It is measured in millimeters of mercury, mmHg, and is typically represented as two values. Systolic pressure, the higher value, which represents the pressure in the arteries when the heart contracts, beats. Diastolic pressure, the lower value, which represents the pressure in the arteries when the heart is at rest between beats. A normal blood pressure reading is typically around 120/80 mmHg. Hypotension occurs when the blood pressure drops significantly below this range. Heart attack, myocardial infarction. A heart attack, or myocardial infarction, occurs when the blood flow to a part of the heart muscle is blocked, usually by a blood clot. This blockage can damage or destroy part of the heart muscle due to the lack of oxygen and nutrients. The symptoms of a heart attack can vary but often include chest pain or discomfort, shortness of breath, nausea, lightheadedness, and cold sweats. Relationship between blood pressure and heart attack. A sudden drop in blood pressure can be problematic because it can reduce the flow of oxygen and nutrients to vital organs, including the heart. When the heart muscle doesn't receive enough blood supply, it can lead to tissue damage, which, if severe and prolonged, can result in a heart attack. Several factors can lead to a sudden drop in blood pressure, including dehydration, severe bleeding, certain medications, anaphylactic shock, severe allergic reaction, septic shock, severe infection. It's important to note that while a sudden drop in blood pressure can contribute to triggering a heart attack, it's not the only cause. Heart attacks can also be caused by atherosclerosis, buildup of plaque in the arteries, coronary artery spasm, and other factors. If you or someone else is experiencing symptoms of a heart attack, it's crucial to seek medical attention immediately. Prompt medical care can significantly improve the chances of a positive outcome. Remember that medical information can change over time, so it's a good idea to consult with a medical professional or trusted sources for the most up-to-date and accurate information.